Hello, everyone. You're live with Jonathan Manus, President of Manus Veteran Medical, and today we are continuing our discussion about the Diowave laser, which you can see here behind me. I can tell you, I got mine actually in the mail yesterday. I've been, learning about it, using it, working with it. It is so simple to use. I'm so very happy about this. It's going to be great to get this out to the VAs, to get it in your hands so you can see it, touch it, and understand what we're doing. But today, my special guest is Dr. Hatgis. He's coming up today. He has definitely spent some time at the VAs. I'm going to let him tell you all about that and continue to grow and educate about the Diowave laser. So, with no further ado, Dr. Hatgis.
Hey, how are you tonight?
Doing good. Thank you so much for being here tonight and continuing the discussion about the Diowave. We've had some back and forth about the effectiveness of the laser, ease of use of the laser, but you got to spend some time in the VA down there in Florida. If you don't mind, please tell everyone about that time and go over any topics you'd like to go over with that, sir.
Absolutely. So, my residency was in physical medicine and rehabilitation, which is one of the primary specialties at the VA. They see a ton of patients all day, every day, Monday through Friday. And I was able to experience 3 months in that department, and I was able to actually experience a month or two in the pain management department as well. And really, we could see that there was a lot of good that occurred at the VA, but there was also a lot that is left to be desired in regards to how quickly and how effectively these veterans can be treated for their issues for pain and function. So when I was there for the 3 months in the physical medicine and rehabilitation department, it was weeks to months of them even getting an initial appointment to go over what sort of pain issue they had. Then after it would be ordering imaging. That could be another several weeks to months in terms of them getting that. Then once that's done, it's going to take even more time to get whatever treatment plan is established based off of that imaging and other testing. And then there's, weeks to months worth of waiting to get whatever injection or other modality could be done. And, we say, okay, maybe it's a few weeks or months, but there's so many different stages to this that it winds up becoming, in many instances, like a third of a year or half of a year before patients could actually get treatment, before they could actually feel better. And to me, that's just really not acceptable, especially when we're dealing with a veteran population who's really in need to get solid pain relief as soon as they could. So then a lot of people don't want to wait that long and they seek services outside of the VA, which is kind of counterintuitive to why the VA really should exist. So, unfortunately, I saw a lot of this delay, as well as there not being as much of a plethora of treatments available as there maybe should be. So I definitely see something like the Diowave here becoming, a hit at the VA. Hopefully, we could get these in as soon as possible. That way, they could be utilized and be able to treat as many people as possible with this.
And the reason why a couple of key topics that you just hit was so important, and I want to hit this. Every doctor that I talked to at the VA says they're running out of time. They only have a few minutes per patient, and the wait is too long. So what does the Diowave do? It allows a doctor to immediately, after looking at the problem and understand what's going on, at least get them the first treatment, get them going. It's a very quick process, correct?
Absolutely.
And,
So
and
really,
also, go ahead.
I was going to say it's very good initially. You could get pain relief right away in a majority of instances, and then you could set up an actual schedule where it's being done several times a week for certain conditions. For other conditions, it might not be as extreme, where it could be once a week, but there could really be a system involved with this, and it could even be linked with certain departments like physical therapy or chiropractic therapy or something other that these modalities could be applied to, or it could even just be integrated with the specific visits that people have for PT or OT or chiropractic therapies or acupuncture or whatever other sort of things now exist at the VA. So it's very versatile in its use.
Yes, it is. And they have opened this up, Dr. Hatches, to allowing if you do outpatient care that the VA will cover it. So we need to educate that as well, and we will do so. Tell us more about your time at the VA. What was you doing there while you was there? And what do you see as the main difference of working on veterans and everyday folks out here in the real world? Our main focus here at Maintenance Veteran Medical is the veterans, and just what's some of the things you saw?
Well, as a resident, I was pretty much doing, assessments and treatment plans for patients, mainly low back pain, neck pain, shoulder pain, a lot of the things that Diowave actually treats. And, we were ordering imaging studies, electromyography, nerve conduction studies for patients that indicated nerve damage. We're ordering procedures like epidurals and radiofrequency ablations and all the things that I do myself for both veteran and civilian populations at this point in my private practice. But we definitely, even then, saw a need for something like this there. And it was to such a degree that I would see some of these patients in clinic. I would see them, let's say it was, I forget the months, but let's say I saw them in September, and it wouldn't be until December until they were actually receiving the treatment that we ordered for them 3 months ago. And that to me was really heartbreaking. So we see a lot of the same conditions in the civilian population as we do in the veteran population, but we see so many of them in the veteran population, meaning it might not just be somebody's back. It's probably going to be their back, their shoulder, their neck, their ankles. They might have Asian orange exposure. They have neuropathy, in their feet and their hands. They may have a traumatic brain injury or PTSD. It's so many different things with the veteran population. So if this is how it's going to address all of these different ailments, especially, mental health added to that, I don't know how this population is able to survive. And, it's heartbreaking.
Well, it's through solutions like this, and all the VAs that are going to be watching this understand. We know that you have a massive responsibility. We know that there's a lot of people that you have to see in a small amount of time. What we're doing is bringing to you solutions and opinions so we can help you with this problem. What we want to do is keep painkillers out of people's systems. We want to give other options for people to heal. And I know this as an amputee veteran. I know that this technology works. Dr. Hatgis knows that this works, and we want to educate you so you know that it works. If you have any questions, you can reach out to myself. I'll get you directly in touch with Dr. Hatgis, and we will continue to educate and lift all the veterans up at the VA. Dr. Hatgis, what's the best way for people to reach out and get in touch with you if they have any questions?
Sure. Probably through email is easiest. That way we could communicate and maybe set up a call. My email is literally my name, as you see down below. So jesse.hatchis@gmail.com. That's probably easiest.
All right, I'll make sure I'll post that in the link as well. We're going to continue to have this discussion, continue with the education. I want everyone to know we will be at the VA shows moving forward with the Diowave laser, and we want you to come see it, feel it, and touch it. Ann Arcillo, thank you so very much for putting on these shows. You do a great job, and we love you very much. Thank you for supporting Maintenance Veteran Medical and all the other SDVOSBs out there. Dr. Hatgis, do you have any final words today, sir?
No, just hoping that this gets in, and I think it's going to be extremely helpful when it does.
Well, everyone that's watching this, please share this with your colleagues. Understand we're at SDVOSB. It's good to go. We are the exclusive partner for this product. If you need it, we'll get you a quote. Anything that you need, we will be there. If you need a demo, just ask. We'll have it right to you. Thank you very much for your time. Hope you have a great day, everybody. And Dr. Hatgis, thank you very much, sir.
Thank you for having me.